We're standing at the dawn of a new era in nuclear medicine, where artificial intelligence AI doesn't just assist, it fundamentally redefines what is possible. Imagine a world where diagnosing diseases is no longer a guessing game. We can now see inside the human body in ways that were once limited to science fiction, and it's all thanks to the powerful fusion of AI and nuclear medicine. In the past, we relied on radiologists and medical experts to interpret complex imaging data, often requiring hours of analysis and sometimes leading to human error. Now, AI steps in as a reliable partner, processing data with unimaginable speed and precision. With deep learning algorithms, we can teach AI to recognize even the subtlest changes in tissues or organs, allowing us to detect conditions like cancer, cardiovascular diseases, or neurological disorders earlier than ever before. Early detection, as we know, often means the difference between life and death. Consider the integration of AI into PET positron emission tomography and SPECT single photon emission computed tomography scans, two of the most sophisticated imaging tools in nuclear medicine. These scans create intricate maps of metabolic processes in the body. And now, thanks to AI, we can interpret these images in real time. No longer do we have to wait for a radiologist to report days later. We can now spot abnormalities instantly, predicting how diseases will evolve, and tailor treatment plans with unprecedented precision. The potential for personalized medicine, where treatments are customized to an individual's unique biological makeup, becomes a reality. But it's not just about speed and accuracy. AI helps us identify patterns in vast amounts of data that would take human minds years to comprehend. We can analyze genetic markers, patient histories, and lifestyle factors alongside nuclear imaging data to predict disease outcomes more effectively. This predictive power enables us to intervene before diseases progress, offering preventive treatments that could change the course of a patient's life. And the impact doesn't stop at diagnostics. AI is revolutionizing how we deliver therapeutic nuclear medicine. In targeted radionuclide therapy, for example, AI helps calculate the exact dose of radiation required to attack cancer cells while sparing healthy tissue. This level of precision minimizes side effects, improves patient outcomes, and speeds up recovery times. We're talking about smarter treatments that adapt to the patient's body in real time, optimizing effectiveness at every step. The future we envision is not distant. It's happening now, in research labs, hospitals, and clinics across the globe. We are already seeing AI-driven nuclear medicine help doctors make more informed decisions, shorten diagnostic times, and ultimately save lives. We are living in a moment of profound transformation where technology and medicine are merging in ways that were unimaginable a few decades ago. As we continue to harness AI's potential, the boundaries of what we can achieve in nuclear medicine are being pushed further every day. It's not just the future of healthcare, it's the future of human potential. And together, we are at the forefront of this revolution. In nuclear medicine, we find ourselves at the intersection of advanced technology and the intricate workings of the human body. The images we rely on are not just snapshots, they are windows into the very essence of biological function. Whether it's a scan of the brain, the heart, or a vital organ, these images hold the key to diagnosing diseases that may otherwise remain hidden. But as we know, the path to accurate imaging has been fraught with challenges. The process of reconstructing these images has historically been an uphill battle. We've faced the problem of blurred outlines, where the difference between healthy tissue and disease becomes a hazy guess rather than a clear distinction. Imagine trying to look at a distant object through a foggy window. That's what blurry medical images felt like. We understood that each blurred pixel could mean the difference between a precise diagnosis and a missed opportunity to catch an illness early. Then there's the issue of incomplete data. Nuclear imaging involves the collection of radioactive signals emitted by the body after the introduction of a tracer, a substance designed to highlight specific biological processes. These signals are captured by detectors and then translated into an image. But here's the problem. This data is often incomplete. The signals might be weak or scattered, and reconstructing an accurate image from these fragments is like trying to piece together a puzzle with missing pieces. we've come to realize how costly these imperfections can be. For the patient, an unclear image can lead to a delayed diagnosis or even a misdiagnosis, potentially changing the course of treatment in ways that could have been avoided with clearer imaging. For the medical team, it means uncertainty, the kind of uncertainty that can make even the most experienced professionals hesitate. And so, the field has continually pushed forward, driven by the need to improve accuracy, resolution, and data collection in nuclear imaging. We've seen advances in algorithms designed to sharpen images, giving us a clearer picture of what's happening inside the body. Sophisticated reconstruction techniques now help us fill in the blanks where data is missing, allowing for a more complete and accurate view of a patient's condition. Each improvement in the process brings us closer to the ultimate goal, diagnostics that are not only more precise but also faster and safer for the patient. Despite the strides we've made, we know the work is far from over. As we continue to refine our tools and methods, we remain acutely aware that every scan, every image, holds the potential to change a life. Weston at the frontier of a technological revolution, one where deep learning has reshaped the way we approach medical imaging and data correction. For years, radiologists and healthcare professionals relied on traditional imaging techniques that often left us with gaps, blurry areas in scans, incomplete datasets, and ambiguous results. These shortcomings were once thought to be inherent limitations of the technology. We accepted that some information might be lost in the process, and in many cases, doctors had to make educated guesses to fill in the blanks. But with the rise of deep learning, everything changed. Deep learning, a subset of artificial intelligence, works by mimicking the neural networks of the human brain, learning from vast amounts of data to make increasingly accurate predictions. When we began applying this technology to medical imaging, we saw remarkable improvements. What once required manual reconstruction by experts is now handled by algorithms that can process and interpret massive volumes of data with unparalleled precision. A scan that may have been incomplete due to poor resolution, noise, or patient movement can now be reconstructed almost perfectly. The AI fills in these gaps, not by making random guesses, but by learning from thousands, even millions, of similar cases. It understands the patterns, structures, and abnormalities in the human body at a level of detail that even a seasoned expert might overlook. Take, for instance, MRI scans. These complex images often suffer from noise or distortions that obscure critical details. In the past, radiologists would spend hours refining these images or conducting additional scans, which could be costly and uncomfortable for patients. But now, thanks to deep learning, the AI can correct these flaws in real time. It identifies incomplete or unclear data, cross-references it with a vast dataset of prior scans, and reconstructs the image to reveal what was hidden. It's as if we've handed the machine a puzzle, and it assembles the missing pieces for us with near-perfect accuracy. The implications for patient care are profound. We are no longer working with partial information. AI systems are now able to enhance low-quality images, detect subtle abnormalities that might have gone unnoticed, and even predict the progression of certain diseases based on incomplete data. A radiologist can look at an AI-enhanced image and see a clearer picture of the patient's health than ever before, leading to earlier diagnoses and more accurate treatments. This advancement isn't just limited to imaging. Deep learning is revolutionizing how we handle data across the entire healthcare system. Incomplete patient records, once a major obstacle to effective care, can now be analyzed and corrected using AI models that draw from broader datasets. We can now infer missing information in a patient's history, cross-referencing it with similar cases to make well-informed predictions. This reduces the risks of misdiagnosis, allows for better personalized treatments, and ensures a more seamless healthcare experience. It's astonishing to think how far we've come. From a time when incomplete data was seen as an unavoidable challenge, we now find ourselves in an era where AI doesn't just assist but actively enhances our ability to provide care. With deep learning, we no longer have to settle for gaps or uncertainties. Instead, we move forward with the confidence that our technology can fill those gaps, giving us a more complete and precise understanding of the human body than ever before. When we think about how deep learning has transformed fields like healthcare, it's almost like witnessing the human brain itself adapt and evolve. We're talking about algorithms that, much like our own minds, are able to learn from an overwhelming volume of data, processing it in layers, and continuously refining their understanding. Imagine we have a set of medical images, perhaps MRI scans, that are crucial for diagnosis. But some of these images are compromised, blurred, noisy, or partially missing due to machine malfunctions or data loss. Traditionally, analyzing such degraded data would be nearly impossible or would require highly skilled radiologists working under significant uncertainty. However, with the power of deep learning, the game changes. What we see happening is that these deep learning algorithms, much like the neurons in our brain, sift through enormous amounts of similar medical images to identify patterns. These patterns are more than just simple visual cues. They involve subtle relationships, contrast, shifts, pixel arrangements, and intricate textures that might be invisible to the naked eye. Over time, with enough data, these algorithms begin to recognize these patterns with extraordinary precision. It's like we're teaching a machine to see not just as we do, but far beyond our visual capabilities. And here's where it gets truly fascinating. Even when the images we feed the system are highly degraded, deep learning can reconstruct them, often with stunning accuracy. It's as if the algorithm fills in the gaps based on what it's learned from the vast pool of previous examples. The blurry areas become sharper, missing details are reconstructed, and the final output is often a near-perfect representation of the original image. This isn't magic, it's mathematics and data working in harmony. From a health perspective, this means that diagnoses made from compromised images could still be accurate, potentially saving lives when speed is critical. It's like giving doctors the ability to see through the fog, to interpret images that would have once been discarded as unusable. We're in an age where technology has intertwined deeply with our understanding of health and science, and nowhere is this more evident than in the field of medical imaging. It all begins with a raw image, one that might be filled with noise, distortions, and imperfections. These are the kinds of images we've all seen: grainy X-rays, fuzzy MRI scans, or low-resolution ultrasounds. They're the initial capture of something critical, yet they often need much refinement to provide us with the precise information required for a proper diagnosis. When we work with these raw images, it's like we're looking at a puzzle with missing or blurry pieces. That's where artificial intelligence AI steps in, reshaping the way we interpret visual data in healthcare. By leveraging cutting-edge algorithms and machine learning techniques, AI meticulously analyzes every single pixel in these images. At a scale unimaginable by the human eye, it begins to correct inconsistencies. This process involves identifying what is noise and wanted information that muddles the image and what is valuable signal, which contains the medical details crucial for interpretation. We can think of noise as the static on an old television screen, irritating disruptions that distort the clarity of what we need to see. AI not only removes this static but enhances the image in ways traditional methods couldn't. Imagine staring at an old photograph and suddenly watching the details sharpen, lines become more defined, the blur fades, and previously hidden features pop into focus. This enhancement allows us to observe more than we ever thought possible in medical scans. Take, for example, an MRI of the brain. Traditionally, it might take a skilled radiologist hours to analyze the image and detect abnormalities. But with AI, the image is first purified, stripped of its noise, adjusted for optimal clarity, and then fine-tuned to highlight regions of interest. The AI doesn't stop there. It goes beyond what our eyes can immediately discern, comparing the data with millions of other images to recognize patterns that indicate potential issues such as tumors, lesions, or atrophies that might not have been immediately obvious. Through this process, we are not just working with clearer images, we are enhancing our entire diagnostic capability. The AI learns from every image it processes, constantly improving, becoming faster, more accurate, and increasingly reliable. This is particularly significant in areas like early cancer detection, where subtle changes in tissue can be the difference between early intervention and delayed treatment. In these cases, AI acts as a second set of highly trained eyes, capable of detecting minute differences that might otherwise go unnoticed. Furthermore, these refined images can even aid in predictive analytics. By enhancing and analyzing medical images, AI systems can sometimes predict the onset of conditions before they fully manifest, giving healthcare providers the crucial lead time necessary for. In essence, what we're doing is transforming raw, imperfect data into a reliable tool for life-saving interventions. Through advanced AI techniques, we are no longer limited by the imperfections in the images we capture. Instead, we're empowered by the technology that can see beyond those imperfections, helping us detect, diagnose, and ultimately treat patients with an unprecedented level of precision. This is not just the future of medical imaging. It's the present, and we are at the forefront of this revolution. When we look at the result, we see a clear, detailed image that leaves no room for doubt. This isn't just a technological marvel. It's a pivotal tool in the medical field, transforming the way doctors make decisions. Imagine this: a patient arrives with vague symptoms, something that could be as simple as fatigue or as serious as an underlying heart condition. Without the right diagnostic tools, even the most experienced physicians might second-guess their decisions. But with high-resolution imaging, everything changes. The moment the scan is complete, we're presented with a sharp, accurate picture that gives us a direct look inside the human body. No more guessing or relying on symptoms alone. This image, rich in detail, becomes the cornerstone of the entire diagnostic process. It allows us to pinpoint problems we couldn't detect before, such as small tumors, blockages in blood vessels, or tiny fractures that would have been easily missed with traditional methods. But it's more than just about seeing. This clarity gives doctors the confidence to act. Picture the tension in a room as a medical team debates the best course of action for a critical patient. Time is of the essence, and every second counts. The clearer the image, the faster doctors can interpret the findings, leading to quicker, more accurate decisions. With this tool in hand, physicians no longer have to rely on what-if scenarios. The precision of the image allows them to map out the best treatment plan, whether it's surgery, medication, or another form of therapy, with the full assurance that they're making the right choice. Moreover, this level of clarity reduces the chances of misdiagnosis. In the past, an unclear image could lead to the wrong conclusions, resulting in treatments that miss the mark. But now, we can confidently identify problems that were once hidden in the shadows. This technology essentially brings light into those dark corners, helping us to diagnose faster and more accurately. For the patient, this means fewer invasive procedures, faster recovery times, and, ultimately, a greater chance of survival. This advanced imaging technology also facilitates communication between medical professionals. When doctors, surgeons, and specialists all have access to the same precise image, it unifies their understanding of the situation. There's less need for lengthy explanations or second opinions. Everyone can see the same clear picture, allowing for a more collaborative, confident decision-making process. In essence, the result of these clear, accurate images is more than just improved diagnostics. It's a shift in the entire medical approach. By providing a detailed, reliable foundation, we help medical professionals navigate the complexities of the human body with greater precision and certainty, ultimately leading to better patient outcomes and more effective healthcare. We're at a fascinating crossroads where artificial intelligence is reshaping the landscape of health and medical science. For years, we have relied on manual data analysis and human processing power to unlock the secrets hidden in complex datasets, whether they be medical images, genetic sequences, or patient records. But now, the narrative is changing, and we are witnessing firsthand how AI is revolutionizing these processes. What used to take us hours or even days to analyze can now be completed in a matter of minutes, or, in some cases, seconds. Imagine we are working with a set of MRI scans where traditionally, radiologists would spend hours meticulously reviewing every slice of the skin to identify anomalies. This process not only demanded time but was also prone to human error, given the sheer volume of data. Today, AI algorithms equipped with machine learning and deep learning techniques can scan through the same images, compare them to a massive database of similar cases, and highlight any potential areas of concern with astounding precision, all in a fraction of the time it once took. What used to be a bottleneck in the diagnostic process is now streamlined and optimized for speed and accuracy. This isn't just about raw speed, though. The quality of the outputs generated by AI-driven processes is often superior to what we could achieve through traditional means. For example, in genomic analysis, where mapping the entire human genome once took years, AI has reduced this time frame to mere hours. By automating data processing, AI helps us catch subtle patterns that could otherwise be overlooked, whether it's spotting early signs of cancer in a tissue sample or identifying genetic markers for diseases like Alzheimer's or Parkinson's. The more data we feed into these systems, the better they become. We are no longer limited by human cognitive capacity or the number of hours in a workday. Instead, we are unlocking unprecedented opportunities for early diagnosis, personalized treatments, and even predictive health models. And the ripple effects are profound. When processing time is reduced from hours to minutes or seconds, we free up valuable time for healthcare professionals to focus on what truly matters: patient care. What can foresee a future where AI not only continues to improve the speed and accuracy of medical diagnostics but also makes healthcare more accessible? Imagine rural hospitals or understaffed clinics utilizing AI to quickly assess patients, ensuring that no time is wasted in critical situations. By integrating AI into every level of healthcare, from research labs to patient bedsides, we are setting the stage for a system that is not just faster but smarter, more responsive, and ultimately more humane. In reducing processing times, AI is helping us achieve what once seemed impossible. But, more importantly, it is allowing us to shift our focus from the mechanics of data handling to the heart of healthcare itself, providing faster, more accurate, and more personalized care to every individual. We're at a fascinating crossroads where artificial intelligence is reshaping the landscape of health and medical science. For years, we have relied on manual data analysis and human processing power to unlock the secrets hidden in complex datasets, whether they be medical images, genetic sequences, or patient records. But now, the narrative is changing, and we are witnessing firsthand how AI is revolutionizing these processes. What used to take us hours or even days to analyze can now be completed in a matter of minutes, or, in some cases, seconds. Imagine we are working with a set of MRI scans where traditionally, radiologists would spend hours meticulously reviewing every slice of the skin to identify anomalies. This process not only demanded time but was also prone to human error, given the sheer volume of data. Today, AI algorithms equipped with machine learning and deep learning techniques can scan through the same images, compare them to a massive database of similar cases, and highlight any potential areas of concern with astounding precision, all in a fraction of the time it once took. What used to be a bottleneck in the diagnostic process is now streamlined and optimized for speed and accuracy. This isn't just about raw speed, though. The quality of the outputs generated by AI-driven processes is often superior to what we could achieve through traditional means. For example, in genomic analysis, where mapping the entire human genome once took years, AI has reduced this time frame to mere hours. By automating data processing, AI helps us catch subtle patterns that could otherwise be overlooked, whether it's spotting early signs of cancer in a tissue sample or identifying genetic markers for diseases like Alzheimer's or Parkinson's. The more data we feed into these systems, the better they become. We are no longer limited by human cognitive capacity or the number of hours in a workday. Instead, we are unlocking unprecedented opportunities for early diagnosis, personalized treatments, and even predictive health models. And the ripple effects are profound. When processing time is reduced from hours to minutes or seconds, we free up valuable time for healthcare professionals to focus on what truly matters: patient care. We can foresee a future where AI not only continues to improve the speed and accuracy of medical diagnostics but also makes healthcare more accessible. Imagine rural hospitals or understaffed clinics utilizing AI to quickly assess patients, ensuring that no time is wasted in critical situations. By integrating AI into every level of healthcare, from research labs to patient bedsides, we are setting the stage for a system that is not just faster but smarter, more responsive, and ultimately more humane. In reducing processing times, AI is helping us achieve what once seemed impossible, but, more importantly, it is allowing us to shift our focus from the mechanics of data handling to the heart of healthcare itself, providing faster, more accurate, and more personalized care to every individual. Speed and precision, combined for a more efficient and secure future, have become the foundation of nearly every advancement in modern healthcare. As we stand on the threshold of a new era in medicine, these two qualities, speed and precision, are not merely objectives, they are necessities in the realm of diagnostics, treatment, and research. Achieving both in tandem has unlocked opportunities that were once unimaginable. We've seen the impact of this in the development of life-saving technologies. Take, for instance, the rise of precision medicine, where treatments are tailored to individual genetic profiles. This approach enables us to target diseases at their core with unprecedented accuracy, sparing healthy cells and minimizing side effects. But precision without speed is like a locked door with the right key but no urgency to turn it. Speed is what transforms this precision into timely intervention. A targeted cancer therapy that reaches the patient faster can make the difference between remission and progression. In diagnostics, the union of speed and precision has revolutionized how we detect and respond to diseases. When we think about the speed of testing, like the rapid development of COVID-19 testing platforms, it becomes clear that without the ability to diagnose quickly, a precise diagnosis would still lead to delayed treatment. We saw how real-time PCR, polymerase chain reaction tests, known for their precision, became our frontline tool, and the race to develop them faster was critical to saving lives. The faster we could identify the virus with precision, the quicker we could quarantine, treat, and limit its spread. Now, as we push the boundaries of what's possible, artificial intelligence, AI, and machine learning are at the heart of this revolution. We are training algorithms to interpret medical images with a speed and accuracy that surpasses even the most skilled radiologists. AI doesn't tire, doesn't miss subtle patterns, and can process data at incredible rates. When we pair this computational speed with precise algorithms, we're giving doctors the tools to detect diseases like cancer in their earliest stages, before they manifest in ways that traditional methods would miss. Imagine an AI system that can scan hundreds of MRI images in the time it takes us to drink a cup of coffee, identifying microscopic abnormalities with pinpoint precision. This kind of power ensures that more patients receive early diagnoses, leading to more effective treatments and better outcomes. In surgery, robotics offers another compelling example of how speed and precision are reshaping outcomes. Robotic-assisted surgeries allow surgeons to perform operations with fine-tuned precision, manipulating instruments in ways that human hands could never achieve. These systems reduce human error, minimize tissue damage, and accelerate recovery times. For the patient, this means fewer complications, shorter hospital stays, and faster returns to normal life. But beyond the technology itself, we also see speed and precision at work in the systems that deliver healthcare. Efficient hospital workflows, where electronic health records (EHRs) are integrated seamlessly into care processes, ensure that medical teams can access accurate patient data quickly, reducing errors and improving outcomes. Telemedicine, too, is accelerating the time it takes for patients to get expert consultations, especially in remote or underserved areas. In minutes, patients can connect with specialists who deliver precise advice, saving valuable time that might otherwise have been lost to travel and scheduling delays. The importance of speed and precision is equally apparent in our efforts to prevent future pandemics. We've already learned the hard way that early detection is key to containing outbreaks. As we continue to develop advanced surveillance systems, we will be able to detect viral mutations in real time, deploy vaccines faster, and create more precise treatment protocols. Speed in response is critical, but without the precision to target the right virus strains and understand their behavior, those efforts would be wasted. Ultimately, as we integrate these advances into the broader healthcare system, we are moving toward a future where the speed at which we can respond to health crises and the precision of our interventions will determine the quality of care we can provide. We're seeing a shift from reactive medicine, where we treat diseases after they've taken hold, to proactive, predictive medicine, where we intervene before they become life-threatening. This is not just about improving outcomes for individual patients. It's about creating a safer, more resilient healthcare system that can withstand the challenges of tomorrow. We're on the brink of something transformative. By embracing the fusion of speed and precision, we are building a future where healthcare is not only more efficient but also more personalized, accurate, and accessible to everyone. The combination of these forces is not just a trend, it's the roadmap to a healthier, more secure world. And together, we'll continue pushing the boundaries, ensuring that no one is left waiting when their life depends on it. Weston at the forefront of a new era in medical imaging, where precision is no longer just a goal, but a reality. With these more accurate images, we are now able to unlock levels of detail previously unimaginable, allowing us to see into the human body with clarity that transforms how we approach diagnosis and treatment. It's not just about seeing more, it's about seeing better, deeper, and with unprecedented accuracy. When we speak of more precise images, we refer to the extraordinary advancements in imaging technologies, be it through MRI, CT scans, or even cutting-edge innovations like PET scans or functional imaging. These tools now provide us with intricate views of tissues, organs, and even cellular activity, granting us the ability to detect abnormalities earlier and with far greater specificity. Before, we may have had to rely on symptoms or broad images to guide us, but now, we can pinpoint the exact location, size, and nature of issues with remarkable detail. This new level of precision translates directly into more accurate diagnoses. Where once there was uncertainty, now there is confidence. We can identify tumors that might have gone unnoticed, track subtle changes in the progression of diseases, and catch conditions before they become life-threatening. It's as if we are able to see the full story of a patient's health, rather than just scattered chapters. But it doesn't stop at diagnosis. With this enhanced imaging, we can plan treatments that are tailored to the individual in ways we couldn't before. We are no longer bound to one-size-fits-all treatment plans. Instead, we can develop personalized strategies targeting diseases with pinpoint accuracy. For example, in oncology, we can map out the exact boundaries of a tumor, sparing healthy tissue and delivering radiation or surgery in the most efficient way possible. This reduces side effects and increases the chances of success. We can also use these images to track how well a treatment is working, adjusting it in real time to improve outcomes. Most importantly, we are saving lives. This level of confidence rooted in data and clarity allows us to act faster and more decisively. Every second counts when diagnosing a stroke, when planning a heart surgery, or when treating cancer. With precise images guiding our hands, we can intervene sooner, more effectively, and with outcomes that were once out of reach. In this new era, we are no longer simply reacting to disease. We are anticipating it, targeting it, and in many cases, stopping it before it becomes critical. This is not just a revolution in technology. It's a revolution in care, driven by the power of precise, detailed imaging that empowers us to save lives with a level of confidence we've never had before. In the evolving landscape of nuclear medicine, we find ourselves at the forefront of a technological revolution driven by the integration of artificial intelligence (AI). The benefits are tangible, reshaping how we approach diagnostics and treatments. With AI-powered image reconstruction and data correction, we are not merely witnessing a shift. We are actively participating in the transformation of patient care. Nuclear medicine, at its core, relies on detailed imaging techniques like PET and SPECT scans that allow us to visualize physiological processes at a molecular level. These scans provide critical insights into various conditions, from cancers to heart disease. However, traditional imaging has limitations. Artifacts in images, noise from low-dose radiation, and the time it takes to analyze results can hinder our ability to make precise diagnoses quickly. But now, AI is stepping in to bridge these gaps. Imagine the typical scenario: a patient arrives for a PET scan, where we inject a radiotracer and wait for it to circulate through the body. When the scan begins, the images produced can often be grainy, requiring significant processing time to refine them for analysis. Before AI, we had to balance image quality with radiation exposure using higher doses of radiation to get clearer images was sometimes necessary, but this carried its own risks. Now, AI-driven reconstruction algorithms are allowing us to obtain high-quality images with lower doses of radiation, reducing the risk for patients while simultaneously improving diagnostic accuracy. AI's ability to reconstruct images at a higher resolution, correcting for noise and motion, means that we can detect abnormalities earlier. Tumors, for instance, that might have previously gone unnoticed in a blurred or noisy image can now be identified at a much earlier stage. Early diagnosis is critical in improving patient outcomes, especially for aggressive diseases like cancer. By catching these conditions sooner, we can start treatment earlier and increase the chances of success. But AI's role doesn't stop at image clarity. It is also revolutionizing how we correct and interpret the data collected. Machine learning models are trained to identify patterns in the images and data that even the most experienced clinicians might miss. These models can compare current scans with thousands of others, highlighting subtle changes that could indicate disease progression or response to treatment. This assists us in formulating more effective and personalized treatment plans. We are also seeing AI's impact in speeding up the diagnostic process. In the past, analyzing nuclear medicine images was a time-consuming task requiring manual interpretation by radiologists. Now, AI algorithms can process and analyze these images in a fraction of the time, providing us with critical insights in real time. This accelerated analysis means that patients can receive diagnoses and start treatment much faster, which is particularly beneficial in time-sensitive conditions like stroke or cardiac emergencies. Furthermore, AI enhances our ability to monitor the effectiveness of treatments. By comparing scans over time, AI algorithms can detect even the slightest changes in a patient's condition, allowing us to adjust treatment plans more precisely. For instance, if a cancerous tumor is not responding to chemotherapy as expected, AI can highlight this earlier than traditional methods, enabling us to switch to a more effective treatment option without delay. What excites us most is the potential for AI to continue evolving. As AI systems learn and improve from the vast amounts of data they process, their predictive capabilities will only get better. In the near future, we might reach a point where AI can not only assist in diagnosis and treatment but also predict how a patient will respond to a specific therapy before it is even administered, guiding us toward fully personalized medicine. We're not simply witnessing these changes from the sidelines. We are part of a paradigm shift in nuclear medicine. By embracing AI in image reconstruction and data correction, we are improving patient safety, accelerating diagnoses, and enhancing the effectiveness of treatments. This is a new era in medical care, one where technology is helping us make better decisions, faster, and with greater precision than ever before. We're living in an era where the future has not only arrived but is actively transforming the landscape of our lives, especially in the field of health. Artificial intelligence AI, in conjunction with deep learning, is revolutionizing medicine in ways we couldn't have imagined a few decades ago. Together, they're enhancing our ability to diagnose, treat, and prevent diseases with unprecedented precision, speed, and, most importantly, a sense of hope. Imagine this: we are sitting in a room where doctors are no longer solely reliant on their eyes or manual analysis to detect subtle abnormalities in medical images. Instead, AI algorithms, trained on thousands, sometimes millions of similar cases, assist us in identifying patterns that might otherwise go unnoticed. Whether it's a minute irregularity in an MRI scan or a barely perceptible shift in a blood marker, these intelligent systems are becoming our allies, offering second opinions that we can trust. Deep learning, with its ability to process enormous datasets, enables machines to learn from experience and continuously improve their accuracy. We're now in a position where early detection of diseases like cancer is no longer a matter of chance or late-stage diagnosis, AI-powered imaging tools have been developed that can detect breast cancer with a level of precision that surpasses even the most skilled radiologists. In cardiology, deep learning models analyze heart rhythms in real time, identifying potential arrhythmias before they turn into life-threatening events. The speed with which AI processes vast amounts of medical data is reshaping our treatment timelines, reducing the lag between diagnosis and action, and, as a result, saving lives. But it doesn't end there. Personalized medicine, once a distant dream, is becoming a reality. Thanks to AI, we now have the ability to tailor treatments to an individual's unique genetic makeup. Instead of offering a one-size-fits-all treatment plan, we can predict how different patients will respond to medications based on their genetic profiles. AI models are not just guiding us in choosing the best drugs, but are also helping us design entirely new therapies, accelerating the development of life-saving medications. What's even more remarkable is the role AI is playing in overcoming barriers to healthcare access. In regions where medical expertise is scarce, AI-driven diagnostic tools delivered through smartphones or basic medical equipment allow us to reach people who were previously underserved. By analyzing symptoms and medical histories, these tools give accurate assessments, offering care in remote areas that have long been neglected. However, as we embrace this new frontier, we are also navigating ethical questions. We are at the helm of ensuring that AI is used responsibly. How do we protect patient privacy when AI relies on massive datasets? How do we balance the efficiency of algorithms with the critical human touch that defines healthcare? These are questions we must face, but the potential of AI, when used thoughtfully, far outweighs these concerns. As we move forward, we are not just talking about machines taking over jobs, but about machines working with us to enhance our capabilities. We stand at the threshold of a healthcare revolution, where AI and deep learning are bringing us closer to a world where diseases are caught early, treatments are customized, and hope is not just an abstract idea, but a tangible outcome. The future of health is here, powered by AI, and together, we are pushing the boundaries of what's possible, redefining precision, speed, and, most importantly, hope.